Hindi team. Good evening, good afternoon, and good morning. This is the 1899th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. V.K Karunakar. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, the local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends. The purpose of this forum is to take homeopathy to every home around the world. As you all know, today our guest is Dr. Karunakar. He has completed MD in homeopathy and is the medical officer. Medical officer. He's the medical officer at a government homeo dispensary in Nellore and a former assistant professor, government homeopathic medical college, Kadapa, and he is a senior consultant, Karunya Homeo Care, Kadapa, and Vinayaka Homeo Wave, Hyderabad, Vasundhara Yashodhara Homeo Clinic, Nellore. He has more than 14 years of clinical experience. Doctor has presented so many sessions in this forum. All the sessions were exemplary, brilliant, and all sessions he presented a lot of cases, and that's the success stories of from his kitty. As you all know, tomorrow we are celebrating the 1900th day. So it is the beginning of a new era. That's what let us welcome our guest of the day, Dr. V.K Karunakar. Welcome, doctor. You can. Yes. The slides are visible now.
Okay. Good evening to all. So today I would like to discuss the efficiency of homeopathy in psychiatry and especially in suicidal cases. So first of all, I would like to thank to all whoever participate in this session and Dr. Dhanesh sir for giving this opportunity. So why I have to take this?
Hi, doctor. Can you enlarge the slides?
Yeah, okay.
Because we can see
Okay,
your
sir.
two photos, but you're sharing from the same or two different. You're sharing from your mobile.
No, sir. Laptop only.
Then how it happens? Two pictures are. We can see some two picture from on this, and the slides are very short.
Okay, sir. I will discuss. I try to share.
Okay.
why why I have taken this topic means, so in my experience, I have examined so many patients, irrespective of the age group, from the childhood to old age people. Many times they are consulting me, so my boy was not mingled with others, or my boy was doing some unsocial activities with others. Similarly, in the old age people also, they are not able to mingle or not able to show a responsibility towards the others or community or in the family environment. So it making some inconvenience to us. So is it any solution is there for that? Similarly, in the present scenario, many people were died. So because not only because of diseases or some other conditions, so everywhere from the irrespective of the country, irrespective of the age group. So what is the term we have to listen is so suicide. So suicide himself. So what is mean by suicide? So what is the how we can stop it, that one? How the suicidal thoughts were arising in their person, or like, so every day as increasing the cases, number of cases. There was no solution find out in any other medical profession. Maybe if you are consulting, my boy has such a thought process, or my family members are having that thought process, or he is attempted to some suicidal or homicidal tendencies are having in the person we have observed. What would be the solution? So like that, so any person consulting the other medical profession, they are simply prescribing a sleeping pills or the agents which are depressing the brain activity. So for a period of time through which they are making as inactive brain, inactive person. So that's why, is it any solution is there? Our master Hahnemann, our homeopathic system is the only solution for such a tendencies. But here, even though there is a one topic is there, therapeutic nihilism. Therapeutic nihilism is there in philosophy lectures. So what is meant by therapeutic nihilism? Even though everyone believing the homeopathic science, accepting the believing homeopathic science, it is a great science and a scientific science, but we are not achieving. So why? Because especially in this aspect, the everyone knows the homeopathy treats the individual. Mind is treated as a root cause for all diseases. Everyone accepted this theory, but coming to the practicality or coming to the treatment aspect, we are not achieving our goals. So the governments also afraid. So every day, many people were died himself or either in the form of suicide or in the form of homicide. So the government has established so many committees. What are the causes and the strategies, and what is the solution for a find out? So in the recent scenario, if the state and central government has popularized, so they are launched the yoga or psychotherapy programs in each and every where the deaths were found more number, especially colleges or certain employee offices like that. So why? Because the most of the people belongs to this group is students and employees or some family geriatric group, old age people, because of they are not confident, they are not enjoying their life, so they are not having any confidence to life. So many reasons for this thing. So that's why earlier the psychiatry is a part and parcel of in branch of medicine, but now it is established a separate branch in the medicine. So psychiatry. So earlier there is a relationship between the psychology and the psychiatry. So a sound mind in a sound body, when those individuals are having a sound mind, he is able to do all the things. So his body is also sound. So that's why Hahnemann clearly stated that the mind is root cause for all physical ailments. And sometimes here there is a little bit discrimination is there. Either it is a really mental disease or mental illness, or it is a physical illness. A part of both are combined itself. Sometimes, many times, there is a combination of physical and mental symptoms are we are constituting the our totality. Which one is accompanied, which one is associated, which one is cause for or leads to one more either physical to mental or mental to physical, very difficulty to understand. Without understanding this relationship, either it may be associated, either it may be a causative factor, how it has developed, very difficulty to cure the disease condition. So that's why many a times in our day-to-day patients, we are not concentrated on the money, we are concentrated on the health of the individual or sickness of the individual. Most of the patient, I am not feeling well, but I don't have any problem from either my family or job or in environment like that. But what they are complaining in your clinic is so constant aches. I am not well. So everything is good in my family. I have financially good. I have mentally everything is provided by husband or family, all other thing. But I don't feel comfortability. So they are always continue. They are visited our clinics. So either body pain, simple complaints. There is a vague pains, headache, or a body ache like that. You have to change your medications from the Econite to Ginkgo metallicum. They won't get the result. So they said sometimes there is a better result, sometimes there is no result like that. Why? Because they are not open up. They are not find out the original reason for that one. Even though they are complaining of physical ailment, physical complaint, but the cause is within their mind. So that's why without understanding that mind relation to development of these physical symptoms or mind, we are unable to treat. Even we are exhausted to prescribe the remedies. Patient himself exhausted to take the remedies. So ultimate, they are attributed. Even we are using homeopathy, but there was no result. So it is also like that all other medical sciences. So that's why very carefully understand. So in this aspect, either mind and body is not separable, they are combinedly acted. They are sometimes the mind symptoms are existing as a part and parcel of various disease conditions, and mental diseases are purely originated from impairment of the mind or perversion of the mind, or altered by some other factors which are constantly act on our mind, and it is altered. Here brain and mind are different. One is physical one, and another one qualitative and quantitative one. So certain diseases are originated from quantitatively, they are affecting quality of life. That means mind. Sometimes the quality of life altered. So for longer time, it affects the structural changes in the brain. So cerebral atrophy or some other neurological changes in our brain like that. So that's why there is an association in between them. If you are not understanding properly this one, how the impulses, if you see the most of the deaths were resulting because of impulsive nature, because of depression, or because of anxiety. These are all. So there is always, if you are see our Metromedica also, if you read many drugs, either from the Econite to Ginkgo metallicum, what are the every drug? So they are committing suicide or making or homicide. What is the behind the cause is anxiety, depression, or impulsive nature. So these are all originated from various environmental factors or in their life what they are not achieved. So that's why a mentally healthy person feels so right towards the right situation. Always mentally healthy. When a person feels mentally healthy, so they are having sound body, they are feels responsibility towards others or the towards the community. So, but nowadays we have to wherever we have to see, so this balance is lost. So they are not responsible towards others or towards, even if you see in college the students and lecture relationship, or in the bus or in private places the employee and other human being relationships. Wherever you have to see, most of the times we are even certain incidents. So after seeing those incidents, so why the human beings are like that, why these people are behaving like that without a morality, without a humanity, their behavioral pattern is very very cruel and very very annoying to the society also. A old age man has raped a small girl, or a murderer, a son has attempt to murder or homicide his father or family members. Such incidents were increasing from till day to day or hours to other. Many deaths were resulting because of this. So why? Because there is a alterations, perversions in the psychoanalytic. So that's why there is a need to importance is attributed to the psychiatric cases. Even in more developed countries like America or some USA or like that, so the psychiatric cases were increasing. They are constantly, the entire research work should be done under what is the drug which is controlling their psychiatric problems. Now, in the from the childhood onwards, there is increasing autism cases or ADHD cases. In the old age people, there is a dementia or psycho schizophrenia or mood affective disorders or alcoholic addictions, drug addictions. In the present scenario, drug addictive disorders. Many people are consulting us. So please give me a solution. Even small kids also, students at the student age, they are habituated to drug and they are addicted to the drug. So how they are withdrawn from the drug addictions, or during drug addictions, they are what they have done without their conscious, without their mind controlling, they have committed unsocial activities. So, and also their mind is influenced by some other persons, they have committed to unsocial activities. Ultimate, they are committing suicide like that. So ultimate, there is end. So there is no connection. So that's why there is a lot of importance to the psychology and the psychiatry. So they in present scenario. So what is the scope of this in these type of cases in modern medicine and homeopathy, so through which we have to analyze, understand. So in the modern medicine, they are treated only, there is antidepressant drugs, mainly suppress the brain function. This is the only methodology in allopathic mode of treatment, and they are forcibly suppressing the neurological transmission of chemical substances, all other things, through which they're making a inactive personality, inactive of organ, through which they are controlled for a period of time. What happening, there are so many side effects are originated, or the even lifelong the individual become inactive, they are unable to perform, they are unable to enjoying their normal activities. So what is the advantage of or superiority of homeopathy in this aspect is, so we are not only saving the lives of human beings, not from the psychiatric illnesses, we are preserving pureness of their healthy lifestyles, what they have earlier. May not be possible in 100% all cases, but as much as possible. So we are bring back to the normalcy. We are providing that feeling, that emotion, early what we have, they are enjoying in their life without that feeling or emotions or there is experience. So that is equivalent to stone or a mission. So that main so the man is making as a mission by using all other medical profession, but by using our homeopathic system, we are providing. So that's why we want to understand before going to how we are treating the psychological cases or psychiatric cases, especially in suicide. You have to understand what is meant by mental health. So mental health means most of the things sound mind. So mental health is not only a mere absence of mental illness, how they are communicated, how they are showing their responsibility. So like that, how they are reacted to the individual or surrounding environment is more important. The mentally healthy person has three qualities. What those individuals are having sound mind, these are the three qualities they are possess. What are they? Mentally healthy person feels always comfortable himself. He is comfortable in wherever sit, wherever stand, or in his surrounding environment, and also he feels right in those circumstances. He is whenever you are questioned, he is able to answer in a right manner or responsible manner. But when he is not a mentally healthy, he was giving some quarrelsome nature or hatred feeling or some other unhealthy or ugly expressions are showing. It creates some sort of annoyance or depression in opposite person. Both are. So especially we have to see this type of situations in family, especially wife and husband relationship. So our family, mother and father, children's. In the present scenario, my parents are forcibly ruined their wishes on the child. Child is unable to cope up that one. They are unable to express. Most of the times, the stress levels are increased. They are unable to overcome those stress. They are committing suicide in the present scenario. The tradition is also, they have in their mind their enjoyment, their credibility regarding job or regarding life or regarding whatever the things. They have their own plan, but they are not overcome because of parents' wishes or surroundings or family traditions or other thing. So they are losing this. So that's why they are not convincing their parents. So when the mentally sound, when the mentally feel, especially in the marriage issues and education and job purpose, this type of mentally altered personalities and committing suicide or homicide, losing their life, we have to observe. So that's why they are not right towards the particular individual, towards the particular situation, are like that. Similarly, the mentally healthy person is able to meet the demands. Demands means their goals. What I have earlier said, their goals, either job or career or choosing the subject or choosing the partner, choosing the friend. Even certain families, they are not accepted the friendship with some other, either in the present scenario, girl with boy friendship. Certain parents are not acceptable. Even certain parents are accepted. So because of by seeing them, whatever the social media or some other things, they have some sort of fear, always looking into that mind. So because of constant worry and constantly the person has developed suspiciousness and anxiety, so that leads to some other different kinds of personality disorders or behavioral problems. So they are not comfortable in the family, each and every, even small things, their reactions are so different way and leads to their. So similarly, the needs are more important. So how they are fulfilling the real goals, all other things are. So when they are not fulfilling their goals, especially job or career or partner or friendship, so what happening? They are not mentally good. So most of the movies we have to see, my life, my career is not in our hands. It can be decided by my father or my parent or like that. So these are all different aspects. So these things. So these needs and achievements, when there are so many conflict it takes place in the mind, leads to there is a different type of abnormal personalities or abnormal behaviors are developed. So that's why. So the mental health is not only merely absence of health, so it may be a relation of individual into the community. So now we have to see. So that's why many times Hahnemann has given importance to that individualization. Individualization, what means? So the how they are reacted to the individual in the community. Community wise different, individual, how they are reacted. So nowadays, so no one has responsibility towards the community. So it causes there is a unhygienic environment in the community. Unsocial activities has done by some individuals because of their selfishness or some other benefits we have to see. So whoever mentally healthy persons, they are not done like that. So they are always think and showing a good character towards the community, good responsibility towards the community. So mental health is a state of well-being in which our individual realizes or his own abilities can cope up with a normal stress of life. So when maybe everyone has every day we are hunting. So most of the people are nowadays they are feeling bored. I have heard how is your life? We are questioning. So my life is very there. The answer is also very slow, lagged manner is there. So why bored? Why? So every day morning wake up, I have to finish my works and attend to the duty or leaving the children in a school or like that everything. Or at a weekend we have to go some hotel or food like that. This is a routinism. So why? Because so every day we have done the same activity. When our mind is not in a position to act to or receive those things, so we are mechanical. So when the things are mechanical, we are unable to concentrate further. We are not enjoying that thing. It's the same thing. When your mind is very active, you are enjoying the same thing. So like that. So that's why the individual is where individual has sound mind is realizes how to enjoy the existing things, how to we are arranging or how to fulfill the needs of that thing. So when they are not mentally sound, so they are dependents or the perverted, so they are showing different kind of reactions. So that's why mental health is a fundamental right to our collective and individual ability as humans to think, emotion, interact with each other, earn a living and enjoy life. Even the we have to see. So I received one case, a lady patient, 30 years. She was complaining constantly headache. I tried many remedies. It gives a little bit relief. So many times I asked, is it any stressful events are there? Either here just maybe a family stress or personal stress like that. I have divided into. I asked. I don't have any person. Everything is good like that. So many people are individuals are thought the stress means financial loss or some other loss. I have to interrogate that patient. She tells, so I want to spare with 5 minutes with my husband, but my husband hadn't a time. So he was busy with his activities. I prepared everything every day, but my mind is not accepting this one. So I want to love of him. So wife wants husband's love, a sparing of 5 minutes time. In the busy life, he was provided each and everything. Gold ornaments is there, luxury car is there, other thing. But her mind wants to 5 minutes time. So even though everything is there, but her mind is not satisfied. So constantly this one causes some hormonal imbalance. Hormonal imbalance leads to there is a mechanically inactive person. So it shows some impact on routine or regular life. So it may lead to some other consequences. Every time she visited some other clinics and checked and everything is normal, but she is not quiet. This is a simple reason. So very simple reason. So that's why sometimes they are she is not adjusted to existing life. Her mind was constantly remembering the thought process causes then and started comparison with others. Automatically there is some abnormality in our mind. So that's why so this comparison is also very dangerous one, where comparison is a good and bad. Where you have to compare, where you should not compare, you want to know. That is the main important point here is also the arising of mental. So all mental disorders are very fine discrimination is there, normal and abnormal. Every individual. So even sitting posture, lying posture, eating position, each and everywhere. If you see our repertory, everywhere we want to show regarding even in suicidal tendencies also. There are many mental disorders, different preparation, different presentations. So why? Because mind and body is not separable. They are combinedly act in each and everything. Combinedly act. They are separate. So they are affecting both in one particular situation, especially healthy condition, both are unit, and disease condition also both are unit. So when the person is not mentally sound or healthy, very easy to understand. So we have to observe the following signs in one particular individual. He is not a mentally good or sound. So what is that one? Always worry. There is no smile in his face. Always depressive face or always anxiety face. Doing hurry, all these things, even simple things. So every individual has anxiety or depressive or smile, crying or weeping, all other things. But there is a finer discrimination is there, normalcy and abnormality. As a doctor, it's our duty to discriminate either it may be a normal or abnormal emotion. So you are always worry. So unhappiness, lack of confidence, even simple things, they are unable to mess up. Most of the nowadays, the students come to our clinic. I don't have any confidence, doctor, towards examination, towards every activity. Our parents brought a child. My boy was unable to mingle with others or not getting marks. He is very active in all other aspects. Is it any solution is there? Is it any medicines are there for solution? So as earlier, mathematical weakness or the memory weak in certain aspect, reading aspect or some other aspect, they're all mentally alterations. So lack of confidence. So even you want to present somewhere, they are not prepare confident too. So insomnia. So most of the people are having in the present scenario, insomnia is a commonest problem. So not sleep well. So even few hour, hardly hour, 1 hour, even after sleep, what is your feeling? Why you are not getting? Everything is good. Everyone said everything is good. Why you are not getting sleep? There was no answer. So insomnia is also one of the mirror image alteration of the mind power. So fluctuations of moods. So there is a mood changes, constantly changing certain. We are unable to understand sometimes what they have done in this minute or next minute, like sepia patient. We cannot expect sepia patient. How can she has breathed 1 minute? She propose I love you. Another minute I don't have love towards you. I hate. So like that, different type of feelings are there. I received one of a homeopathic a student was studying, complaining of constant headache and irregularity in her menstrual cycle. So I inquired, everything is normal, investigation wise. I asked why you have, what is your life story or like that. So she is always, her face is under worry. So that means that there is no activeness in her face. I inquired. So what is her mother was suspected her. So maybe by seeing the social media or some other people, always try to compare. So she is unable to digest that one. As a mother, she hasn't confidence towards me. So why she has creating such stories like that? How I can share? So who is understanding my cry or sadness or a thing? Constantly suppressing those emotions. So leads to some organic changes or some alterations in the hormonal. So most of the timings, the mind symptoms are a part and parcel of hormonal symptoms also. So wants to stay alone. Always they are not mingle. So closed rooms, they are always, even 100 people out of 199 are sitting one together. This person is sitting alone. So not facing any problem. They are unable to facing simple things also. Continuous aches. I already told this is. So they are characterized by a combination of abnormal thoughts and perceptions, emotions, behavior, and relationship with others. So what happening? So these are all normal. How any combination, either we are enjoying the friendship, we are enjoying the love, enjoying the family, enjoying the college, enjoying the situation. When we are not enjoying that one, the situation means we are not facing the question in the examination or some other thing. So started there is a depression or anxiety or some other mind perversions or alterations. So they are constantly grown up, leads to development of a mental disorder. So the burden of mental disorders continues to grow with a significant impact on health. So the mind alterations, so they are showing their impact on the physical problems also. Sometimes physical illnesses are showing impact on mind, and mental illnesses are. So you are, as a doctor, you have to understand is it is a mental illness or physical illness. So which one affect the another. So it is your duty, and you have to understand the consequences. So if we are not understanding the consequences, you are unable to understand the curative process, either in the right way the disease has cured or not. So that's why the mental problems are more burden. So to the individual or as it. So the mental health problems are more prevailing. So compared with the rural, urban. But earlier the statement is right. But nowadays in the rural areas also they are corrupted. So the persons are habituated. They are following the urban type of environment. Even in the village people also the psychological problems were increasing. So, what are the general types of mental diseases as per psychiatry textbook? So, the disease classification of the psychiatric illnesses are either maybe psychosis or neurosis or mood affective disorders or substance affective disorders, personality disorders, psychosocial or sexual disorders or behavioral problems. No need to explain. Everyone knows why, because we are all qualified. What is meant by psychosis? What is meant by either in that again each and everywhere there is a functional disturbance. Is there functional psychosis and organic psychosis, functional neurosis or psycho organic neurosis, or mood affective changes, either mania or whatever excited behavioral patterns are there. The substance also alcoholic, or in the present scenario it is more burden. So alcoholic or tobacco smoking or narcotic drugs which were affected. So most of the narcotic drugs were keep in our metromedic as a drugs during drug proving or whatever the way, most of the manifestations are similar. So most of the time in tobacco, Hahnemann clearly or Metromedica in Metromedica mentioned tobacco is used for to nullify the desire of tobacco. Or similarly, there are so many drugs were there, cocaine for cocaine poisoning or the stemmonium for the other poisoning like that. So the similarity of that pathogenetic similarity. So many drugs were proved on that one. We have to use those drugs as per similarity or during drug proving what are the manifestations are appear. So it very easy to nullify. So even thotopathic preparations habituated in homeopathy to nullify these type of things. So the substance affective disorder. So personality disorders. So we have to so many drugs were there for different types of personality. It is a for nothing but constitution. Constitutional diagnosis is there. It is the only quality of our homeopathic system. So lycopodium constitution or lycopodium personality, sepia personality, antimony code personality. So when you have to understand the personality of individual, very easy to treat. So many of most of the students are practitioners having doubt, either complete or patient, even patients also having doubt. So by using this drug completely bring back to this one. Yes, definitely bring back. So without restoration of that quality or that personality, so how we are not saying it is a science. So definitely the personality is also changeable in that one. So psychosocial or sexual disorder. In the present scenario, it is a more problem. So the sexual disparity in the wife and husband or lovers, or most of the homicidal or suicidal things are happening because of this sexual and social unsocial activities of our thing. Next one is behavioral problems. So what are the commonest causes for all these things? So the heredity is maybe by birth itself. So most of the timings, whenever we are interrogate the patient, whoever attended along with patient, they said by birth itself he is like that. By birth itself he is a dull and inactive person. He is not participated in any program like that. So like that they are claimed. We have to understand. So even friends, we are acquaintance with the friends also. They are stated he is not such a type of personality. He is not such a mood or that thing. We are most of the times we have to receive. Oh, this person is like that, this person is like that. So environment by birth itself, that means certain characteristics are acquired. Most of the time he is a father type, he is a mother type, he is a uncle type, like that we are designated. Why? Because these are the qualities of hereditary. So suppose if you want to change this hereditary quality, how? So most of the time in my experience I have observed, so if you want to treat or removing that hereditary abnormal tendencies developed in the generations, you treat the case or administered the miasmatic or constitutional remedies, miasmatic remedies, especially during pregnancy. So not in this generation we have to rectify, at least we are limited those qualities in the next generation. Next generation, so definitely some qualities. If are treated that generation also, completely will be arrested those qualities in the future generations. So this is the only thing we have to administer soric or psychotic drugs. So in a serious manner during pregnancy, so definitely certain hereditary qualities are stopped or arrested in the development in abnormal manner in the future generations. So environmental conditions, this may be most of the environmental conditions presented as a modalities. So in the mental conditions also influenced by these environmental conditions. So that's why Hahnemann has clearly given that one, you have to change while treatment of mental diseases, you have to change the environment first. So most of the timings we have to give advice patient also to change that room or that place or like that. Without changing that one, so it is a triggering factor. So constantly it influencing that mental character. So it resulting as a more violent. We cannot expect what will happen to next minute. So that's why you can change when the person is emotionally disturbed. You can change that environment first. At least try to calm it or coming down. So that's why environmental conditions also most in the cold environment, hot weather, even suicidal tendency increased during heat condition. They're mentioning in the repertory or cold environment or certain climates. So by going to heights, so the person has developed impulsive character and suddenly jumped out from the heights, either that one or from the windows or like that, or he is developing that impulsive behavior through thrown whoever accompanied him. So like that. So nowadays it is a passion to create. It is an accidentally falling or happening, but intentionally they have done. So those incidents intentionally they have done, but they are creating it is a natural accidental things. So this is a passionately habituated certain individual. So through which you have to understood that the mind of that particular individual, that is thing. So similarly, the organic conditions, the organic certain disease conditions also more important in the TB, AIDS. So whoever having acquaintance those diseases, hepatitis, they are want to commit suicide because of the intolerance of the symptomatology or pathology, or sometimes there is altered mind conditions causes they are unable to balance that one, they are committing suicide or some other things. So the sociopathological, the mental symptoms are mental conditions are developed during. So clearly, Hahnemann has also given one variety of mental disease later will. So sociopathological causes in that there is a genetic and environmental. Even though genes are developed that one, we can change the environment. So through which we can prevent the development of such an abnormal behavioral pattern. We have to see movies. He is a faction family, so we are far away. They are sent to the faraway place, and he grown some other foreign countries. He developed a soft character like that. So it is the only methodology to so changing of the environment through which we can prevent the even abnormal characteristics are there in their families. And hormones. So everywhere there is a cortisol or whatever thyroid hormones or pituitary hormones, they have always showing some impact on mind. So the mind symptoms are anxiety, depression, or impulsive behavior. These are all in the schizophrenia. So many negative characteristics are developed because of hormonal imbalance. Mood swings, especially in PCOD, the mood swings are developed because. So without understanding these hormones and relation with the mind symptoms development, very difficult to do. So relationships, either it may be a social relationship, personal relationship, or family relationship. In the present scenario, the most of the things are unsocially happening in the relationship. So they are unable to digest or understanding the value of relationship. So they are selfishness in the relationship, making spoiling their relationship. Not only spoiling, so it may develop some abnormal impulsive behavior to commit suicide or homicide. This is the thing. Similarly, traditions also, religious insanity. Certain individuals have this traditional insanity or so this is the only they have to turn some other. They are act like a dictators. So through which, so because of certain persons are losing their lives because of the dictator or traditional behavior, all other things. So this may be these are all the commonest causes, all other things what we can do. So how to that means, if you are certain people are developing such a tendencies or disposition, if you are able to study those individuals, early diagnosis and identification of the causative factors, so helps a lot to remove the tendency or disposition by treating or educating through health education or mental psychotherapy. We can move those individuals are becoming normal. So what is the homeopathic approach? As usual, what we said, a holistic, individualistic, miasmatic approaches. So the majorly most of the mental disorders comes under the one-sided disease. Hahnemann was keeping these mental disorders under the one-sided, so they are mainly resulting sora. Later on, the stinge added by the psychotic or syphilitic stinge adder, that may be a tubercle or this thing. So as per the psychiatric diseases are classified by Hahnemann in his Organon of Medicine. So there are four varieties. So the mental diseases are appear after disappearance of corporeal. Sometimes the lung abscess is disappear, but he has developed mental diseases. So like that. So disappearance of physical ailment so leads to development of mind symptoms, or the mental diseases are acute in origin. Sometimes mania, acute impulsive nature, impulsive behavior. So suddenly outburst because of the triggering factor, because of exciting factor, sudden loss of friend or sudden loss of property, sudden loss of anything happening, or they are unable to digest, contradiction. So they are unable to cope up or digest. So mentally subnormal, they commit whatever he has developed mania or some other impulsive behavior. So certain doubtful in origin because of so long-standing fault. He was staying unhealthy environment, unhygienic, so constant worry or a faulty techniques or in the environment. So the environment is not good for growing that one. So make certain diseases were developed. They are doubtful in origin. So sometimes they are reason within the mind. So true mental disease, they are originated from true mental diseases. So ultimate, so our topic, these are all different kinds of how the person has developed different types of person mental mind symptoms, either with the along with physical diseases or alone itself they have developed how to study. So today topic is suicide. It is more important. What is meant by suicide? Death of any individual. How they are the intention to die. Intention to die. So they are the thought process originated himself or inside of the body. So sometimes he may be mentioning the reason, sometimes he is unable to understanding the reason, he may not be mentioned. So the higher suicide rate is especially in the age group 15 to 29 years age group, and higher in males. So males are more because of in the family situation or job environment or certain things, the males are unable to cope up the stress factor levels. They are financially or whatever thing, they are losing their are committing suicide, or because of their habituated luxury life, suddenly loss of luxury life, they are maybe habituated the suicide, so commit suicide. So like that, males unemployed, agriculture, especially the farmers, they are unable to get the proper adequate amount of paddy or other things, financial. Again here, whatever the thing is, so financially, environmental or relationship, these three factors can create anxiety, depression in the individual, so leads to wants to commit suicide. So iron males and employees agricultural field. So what are the factors are contributing to suicide. What are the factors? So provoke that to commit suicide. That means the first one is family problems. So within the family, there is no proper environment, good communication, good environment. There is no support. So even nowadays, this is the common thing we have to observe. Earlier, there is a common families are there. Now individualistic families are there. There was no support, no finance, not only financially, morally, or personally, or friendly, or other thing. So even the selfishness plays a most important factor to spoil the relationships in the family or in other things. And the loss of lacking of morality leads to developing certain abnormal cravings or desires within the family. They are spoiling the relationship causes, so unable to express or committing suicide. And also disease conditions, certain disease conditions also, that means long standing. So the patient was loops like losing hope. So the was not curable. Maybe we are able to suffer with same disease for until die. So why I have to bear it? He was committing suicide. So like that. So many chronic disease conditions, especially chronic disease conditions, the patient loses his confidence and wants to commit suicide. In acute disease condition, they are unable to tolerate. Most of we read in the newspapers or CVs. So the patient was committing suicide because of intolerance of abdominal cramp or because of pain or some other thing. So by seeing those statements, I see why these people are like that. I was feel it is a silly thing. But now, once we have to study those things, so how much pain is there like that we have to understood. So in our drug proving is also like that. Because of intolerance of pain, they want to commit suicide or certain way. And another thing was drug reactions. So addicted to drug, when they are not getting the drug or under the drug influence, they are committing suicide, or sometimes without their conscience, they commit suicide or homicide like that. And marriage relationship. Earlier, marriage is a holy event, but in the present scenario, marriage is one of the event to commit most of suicidal tendencies and homicidal tendencies, because of there is no proper good holy relationship in between two persons. So marriage is also a contact bond, not the relationship, holy relationship. Now is a everyone feel burden or contact. So because of late marriages or early marriages, they are unable to understand the marriage values, all other things. So another one is love affairs. So by seeing in the movie hero heroine, they are habituated, so they are unable to even. It is a passionate thing in the present scenario. Most of the suicides are happening because of love failures. Hahnemann clearly in our Medica clearly given. So love ailments from love failure, ailments love sick, and disappointed love like that. We are under most of the people are not aware for these type of symptoms. There is a remedy for that one. So most of the things not aware of this one. So they are not come approaching homeopathy. They are suffering. Ultimately leads to some chronic conditions or disabilities. Ultimately, it is also provoked to commit the suicides, all other things. So the love failure, so many antimony program is there, lacosis is there, sepia is there. So there are love affairs in between, not only male and female. So children and parents, or children and some friends, in between friends, there are most of the things, the relationships are, there is no love and affection. So because of losing friends, he was commit suicide. I am unable to survive without him, or like that. So maybe so many fears are developed in that because of in the love and failures in career, also professionally and property. So loss of threats, dearest one, loss of properties, or some political issues, and impotency and infertility, because of they are unable to conceive, or impotency. Nowadays, they are habituated to commit homicide or suicidal, sometimes unknown causes. So what are that homeopathic aspect? There is an organon approach. What you have to take the proper case taking, understanding the either mind is involved or not. If suppose mind is involved, what are the mind symptoms? What are the physical symptoms? Most of the timings we are asked either irritable. When he has developed irritability, we are not concentration. We are patient is irritable, patient is anxious. We have to return. But at what time he has developed that one, it is more important. It maybe plays an important role in that concentration of the remedy or not. So like that. So either it may be a mental symptoms are associated, either act like a concomitant or part and parcel of symptoms in the totality. So after taking proper case taking, you have to analyze that one and evaluation of the totality. So through which you have to understanding the either tendency is there or aloneness is there. So through which you have to identify the miasm. So later you have, if it is a corporeal related or mind related, Hahnemann clearly stated in 210 to 230, either whatever the mind, pure true mind disorders, or it may be accompanied with physical disorder. You must, most of the time it is a one-sided diseases. You have to implement the one-sided plan treatment. So if you suppose you go to the repertorial approach, so many direct rubric is there, suicide is there, so many drugs were there, suicide disposition is there. So they are frequently, we have a division. I want to commit suicide. I want to, many times the attempts also there, but failure. So suicidal thoughts are there. Suicide, different types of modalities are given. Suicide, suppose most of the people were, they have developed angry on homeopathic doctor. Why? Because suppose they are expressing, I want to commit suicide. In which way you have to hanging or drowning, or like, if you are questioning like that, if it is you are feeling a jokey, you are taking as a, my emotion is, you are jokey like that. I am not taking a jokey. It is the method of, so many drugs are there, because they are not aware, so that develop angry on you. So there's maybe a drowning is there, antimony tartaricum is there, drosera is there, like shooting, natron sulfur is there, argentum nitricum is there, jumping, argentum nitricum is there, by hanging. So different suicidal impulsive by seeing knife. So alumina is there, hepar sulfur is there, blade or gun. Suicide by various conditions, either maybe love or disease or pain, intolerance, homesickness. So suicide, committing of suicide, most of the students who will stay away from that for the purpose of education. So capsicum, so suicidal tendency develops because of homesickness. Capsicum is there, miscarriages is there. So during menses, Merxal is there very clearly mentioned. So because of I am on a during menstrual period only they have to commit or attempt suicide, because because of mania. So these are all different repertorial approach. Even there are so many, after attempting taking abusive substance, they are attempting different ways. So consuming poisonous substances or hanging or drowning. So for each and every consequences, even mechanically to take the aid of that allopathic or modern medicine to clean up the poison or other thing. After that, definitely homeopathy has a most important role to remove the bad effects of that poisonous or the substance which has taken into the suicidal attempt. It may persisting a longer period, the longer chronic effects of different substances used during suicidal attempt, so removed by that pesticides are used. Because of pesticide, the bad effects are not only relieved immediately, they are nullified by our drugs. So different, coming to the material medical approach, there may be anacardium, suicidal tendency by shooting, no reality. Husband is not mine. Someone is coming, that one, she has to thrown away, or she has committed. So such an unsocial nature is there. Maybe in the arsenic album, because of anxiety, he has developed impulsive behavior. Because of that, he was commit suicide because of anxiety. So alumina is there. Fears of his, he has developed own impulses by seeing knife. He himself cut off seeing all other things. Aromat, hopelessness. He is highly intellectual, but lack of confidence, depression causes to commit the suicide. Even large professional men, lawyers, judges, or doctors, they have to commit suicide. There is without, because of this impulsive behavior. Similarly, antimony crodum is there. So antimony crodum, especially love sickness, they want to commit suicide. That moon sadness during sentimental about his fate. Always they think my fate is not good, my fate is not good. I want to commit suicide like that. So nervous and hysterical things commit to that one. So similarly, so capsicum, homesickness. So they are opposed. Even someone comes and propose, I want to make a friendship, all other thing, they are unable to accept there. Simsifica is also there, trying himself. They are committing, injure himself and fear whoever there in the house, they are killing me. So he was developed impulsive behavior. He would try to homicide, murders, all other things. Lack defloratum is there. So he is not at all interested to care to life. So these are all commonly used words, sometimes coming from the patient words. One, we are attentive. We are not taken into most of the time. Lachesis is there, always compelling, suspiciousness, behavior, impulses causes that way. He was under the super humor. he was giving order to commit to suicide or homicidal. So Hepar is also ferocious. He wants to kill someone. He is unable to tolerate offending or contradicting anything. So Medorim is also suicidal thoughts are there. He is always feel unreality. Everything is not real. Why I have to survive? Why? What is the need? So he was developing that one suicidal. So Nausea is also brooding, suicidal tendency. Variganum is also there, erotic mania. Platina, Medorinum. So the sulfur is a sepia is also. So aversion to her own children, aversion to her own husband. She want to commit. He is not my child. He was not my husband like that. Cannot expect the reactions of all other things. So that ultimate I concluded. So the mentally perverted patient, alteration patients, you have carefully examined under interpretation, understanding of the tendencies. Homeopathy is the only solution for to prevent the tendencies. In acute case, we are unable to. We don't know when he was committing suicide, other thing. When you have observed tendency, you have prescribed on the basis of tendency. So very easy to remove that tendency we are giving. So cause and my identification of the cause, causative prescription and miasmatic prescription. So it can nullify the ego and so both are mind and physical symptoms are considered as homeopathy. So homeopathy is the only therapeutic system having scope in this aspect and preserve the purity of our life. So that's why most of the people are not aware for these conditions there is a medicines all other thing. It is our duty to create awareness, public awareness. So yes, homeopathy has medicines for suicidal or homicidal tendencies where those individuals are having mentally
Yes.
abnormal. At least we can save certain people. This is I
Yes.
thank you for giving opportunity for all whoever participated in this program. If you have any doubt, please ask.
Thank you, Dr. V.K. Karunakar. It was really an excellent session. You really covered almost every part of the suicidal aspect and how it can be managed with homeopathy. Since we have no time to continue, can you please stop screen sharing? Anyway, thank you, Dr. Karunakar, and hope we can have some more presentation in the future, as already the time is over. I'm not extending for the session. Anyway, inviting Dr. Rambaresh sir to say vote of thanks. Oh, there is some network problem. As you all know, tomorrow we are celebrating the 1900 day. A lot of guest speakers are coming out. It will be a pan-Indian session tomorrow. So hope all of you will join us in the celebration of IFPH 1900 day. Thank you, Dr. Karunakar, and those who attend the session in this evening. It's over to Dr. P. Shaila to moderate the Malayalam session.